Hey, here I am. Wanted to go live very quickly to say that I work with all forms of health professionals. And, it's interesting when you have patients who are about to undergo treatment and they're told that they can't take medications. And you probably experience this as a pharmacist, even as a primary care physician. And what I'm talking about is EMDR. Now, here's the really cool thing. This is the big aha. You ready? That benzodiazepines are contraindicated with EMDR because basically they really slow the processing down. And when patients come in and they're concerned about this because now they know they're going to go in for a session and now they're really amped up. So I had an EMDR therapist actually contact me. And we were talking about this, and it happened because of the patient. The patient actually got a hold of me first, connected me with the EMDR therapist, and we talked about this. And the thing is that essential oils actually help a person process their emotions. So you can actually use it in lieu of antidepressants or anti-anxiety medications, but more specifically benzos during those kinds of sessions because the individual is able to has a more cognitive control and the ability to process the emotions. And this was the big aha for this practitioner. So when someone comes into you and is concerned about what to do because this is what they've been advised and they would like your professional opinion, it may not be something that you talk about right now, but it is certainly something that you might want to consider. And this is what I love about them, because they don't take the place of on an ongoing basis, but they certainly can be a foundation to incorporate. And especially if your patients have a familiarity with the aroma, and that would be considered olfactory therapy, which is something I'm going to be talking about with the RPH Ally Soiree that's coming up. If you want to know more about that, just comment down below. And in the meantime, this is something that I can also work with and speak more about, which I'm really excited about, is this AROMA, the workshop coming up on July 27th, that speaks about AROMA is Aromatherapy, Revolutionizing Optimal Medical Approaches. And so when patients come in and they start wondering what the heck they can do, this is something that can be added, because the thing is that what I've experienced is that the individual that was concerned about this integrated the essential oils into an EMDR treatment. The clinical therapist was blown away because the processing of information or processing of emotions was smooth. The individual walked away feeling empowered, and it was a very successful treatment because she could not take her benzodiazepine while she was in therapy. So this was the big aha for both the patient as well as for the physician, for the healthcare professional, the therapist. So this is something that I'm bringing to you because as a healthcare professional, and people come and they're curious about what they can do because of what they've been advised for certain things. Again, if it's not part of your program right now or your consulting, it is within your scope of practice. It's within your scope of practice. So how do you assist your patients with number one, quiet their concerns? You may help quell them and guide them in a way that not only benefits the results, that gets them the optimal results. That's the whole point to aromatherapy, revolutionizing optimal medical approaches. So when we integrate them efficiently and selectively with the individual patient, now the results are phenomenal. And so that's the big aha. This therapist was blown away because, as I said, everything had been kind of messy historically, and now they're finding that with the inclusion of essential oils for a session, she had better results, she was progressing much faster, and it did not interact with the medications once she left. So that said, Let me know your questions about this, because it's not about one replacing the other. It's about how can we integrate these so that your patients know that they're being taken care of and that you have their best interest at heart, because you do. You absolutely do. That's the reason why all of us get into this field. So thank you for doing that. Thank you for being a stand for quality healthcare. And let me know if you have any questions about this. All right. See ya. The big aha is waiting for you.